Good class. I'm Christina Pata by name. I'll be taking you pharmacodynamics and chemotherapy. We understand that drugs are any substance or product which is used to modify or explore the physiological system or pathological state for the benefit of the recipient. Drugs coexist in the unionized form or the ionized form, and this includes existing in form of tablets, capsules, solutions, inhalers, injections, and other forms. Drugs has different sources. Some are gotten from microorganisms. These include the penicillin drugs we all are familiar with. Others are gotten from plant source, like we have the vitamins, the morphine. We have those gotten from the animal source, like the insulin for diabetic patients. We have those from synthetic sources, like the aspirin, the sulfonamides, and other drugs. Then we have those that are bioengineers, like the human growth hormone. Pharmacology entails studying the science of drug actions, their effects and uses. And this is done to achieve a correct dose for an individual patient, which is fundamental to clinical practice. Other terms like pharmacodynamics is the study of the mechanism of this drug action in the body. Here we consider the biochemical and the physiological effects of the drug. While pharmacokinetics is an aspect that deals with understanding how drugs are absorbed, how they are distributed, and eliminated from the body. Drugs molecule interact with a specific molecule in the biological system, which is called the receptor. And for a drug to act, there are certain factors like the drug size, the electrical charge, the shape, the atomic composition, which must be appropriate for this drug to interact with its receptor. Drugs need to have their necessary property for them to be transported from their site of administration to their site of actions. Drugs can be administered through different routes. It could be the oral administration, and here you take your drug, you dissolve it under your tongue, then it goes into your bloodstream via the mucous membrane. We should note that the absorption will start from the mouth or the small intestine. The advantage of this form of administration is that you take the accurate dose and doesn't require any form of special skill. That is, anybody can administer this. But the disadvantage of the oral administration is the fact that it has a slow onset of action. We have the parenteral administration, that is the intravenous, intramuscular, and subcutaneous routes. And the routes of absorption varies. But the advantage here is that there is direct entry into the circulatory system, and there's rapid onset of action. We have drugs that are administered topically, and we have other routes like the interthecal, the elation, and ophthalmic. There are different drugs for different infection. We have the antibacterials, and their essential function is to target the essential bacterial molecular pathway in order to inhibit the growth of the bacteria. We have examples of drugs under which are antibacterials. We have the aminoglycosides, we have the cephalosporin, leukoproteins, we have the lipoglycopeptide, we have the macrolides, we have the oxalidiol. Then we have the antiparasitic drugs like malaria drugs, antiemetic drugs, we have antiviral drugs, those that act as non-nucleoside reverse transcriptase inhibitors. We have those that act as the protease inhibitors, entry inhibitors, attachment inhibitors, and other antiviral drugs. When treating a parasitic infection, let's take for example malaria. We have some chemoprophylaxis which are majorly used for non-endemic area. For a malaria patient, you can make use of mefloquine, you can make use of chloroquine, you can make use of doxycycline. But you want to understand the fact that these drugs target the parasite at different stage of its life cycle. For example, when you are dealing with the asexual blood stage, you can make use of artemisinin and clinolose. But when the drug is intended to target the liver stage of the Plasmodium falciparum, you can make use of atovaquone with proguanil. There are other therapies for emetic infections using praziquantel for cystose infection, trematose infection, And we have other drugs like the metronidate, the bitinol, ivermectin. You need to know that drug needs to be absorbed into the bloodstream and must cross epithelial cells and other cell barrier for it to enter into the blood system. Some drugs require ATP, that is energy, to move the drug from the area of low concentration to area of higher concentration. And some drug uses passive diffusion, that is, they do not require energy, but their movement is influenced by the size and solubility of the drugs. We have different forms of types of lotions and their uses. We have those water-based lotion. They have the light consistency and the application can be on the hand or feet. Then we have those that are silicone-based. This one have thicker consistency. Then we have the oil-based lotion, which can be used on the skin and it stays for a longer period. Let's look at the term toxicology. What is toxicology? Toxicology is the science of poison, their sources, their chemical composition, their action, and the test for detection and antidotes. Preclinical toxicity includes testing for the acute toxicity, subacute toxicity test, the chronic toxicity, the mutagenic potential, carcinogenic, and other potentials. What are the roles of nurses in drug therapy? A nurse ensures that correct dosage is given at the correct time. Then they observe whether there's any specific requirement for a specific patient. They also observe for the side effects and respond when there are unavoidable side effects. Then the nurse are incumbent with the role of educating patients or their relatives on the need to administer drugs at the right time. Then nurses need to care they need to reduce the need for drug therapy by ensuring that patients are treated, continue to maintain good health. The adverse effect the adverse effect event is checked by a nurse using the causality assessment skills. And pharmacovigilance deals with the safety of the drug safety information and other medicinal information about a product. And this includes doing a clinical trial for a new drugs. The quality of the drugs needs to be checked to determine whether it's safe for usage. Then we should understand that a drug could be internal or external. So for a drug that is for external use, a nurse needs to check for the quality and safety of such medical device. Then there's need for prescription audit in hospital. This is essential, like in the use of antibiotics. We all know there's this menace of antibiotics resistance globally. Now, let's look at some drug agency and their policy. Looking at the National Drug Policy, it was founded in 1990 and its main goal is to ensure there is adequate distribution of drug supplies and ensure rational use of drugs, increase the local production of essential drugs. And how do they achieve this? They achieve it through collaborative efforts, strengthening aspects of importation, manufacturing, storage, distribution, and sales of drugs, while promoting the use of herbal remedies. Then we have the revolving fund, which is also established to regulate drugs. Their own role is to ensure that there is constant drug supply in basic healthcare delivery. The government, through this agency, provides an initial seed grant or drug stock to healthcare delivery system, and they also promote utilization of facilities and ensure and encourage effective drug management. There are some drugs we call controlled drugs. And how do you administer these controlled drugs? The health professional in us needs to consider certain factors before administering controlled drugs and substance. And what are the factors to consider? You have to consider the benefit, risk, and source of this drug. Then, for you to administer this drug, you have to document clearly the need and indication for the controlled drug. This must be documented in the patient's care record. Then you need to include the dosage and the instructions on prescription. Then you need to include whether there's any change to the prescription guidance. Ensure you document it in the patient's record. We should understand that except for exceptional cases, controlled drugs must not be administered for more than 30 days. So I'll leave you with this assignment. List other drug agencies in Nigeria and list their specific roles, that is their functions and responsibility. So thank you very much for this. Thank you very much. See you in the next class.